So without further ado, I'd like you to welcome Lord Bradley.
What I want to do is very briefly, in the 20 minutes I have available, is quickly run through my review, what I found and what my recommendations are. So there's a backdrop to our discussions this morning. So I set about that early in 2008 with a methodology which was as broad as I could possibly make it, taking written evidence, taking oral evidence, organising seminars and regional conferences in every part of the country, visiting every setting within the criminal justice, social care and mental health system, courts, prisons, police stations, mental health units, etc., to try to get as broad an understanding of the topic as I possibly could, so that when I did report, I was trying to present practical policy changes that actually could be implemented. It wasn't a high-level theoretical report. It was from the start, I wanted it to be relevant to the people actually working in the system, whether it be in the criminal justice system, the mental health system, the social care system, the voluntary sector, so that the changes I would eventually recommend actually had relevance to the work that all of you are actually doing. So fast forward, and these are only some of the issues, there was no agreement of what diversion actually meant. Were we talking about diverting people within the criminal justice system? Were we talking about diverting people out of the criminal justice system into other settings? And by not having a definition of diversion, we had no idea what the population we're trying to divert actually were. What were our definitions of mental health, learning difficulties, learning disabilities? So we had some feel about who and where they were in the current system and what we could do better to support them. More detail. So fast forward to April of 2009 when I reported to government, although I do stress it was an independent report and not determined by government. What I thought was absolutely crucial was to place my recommendations in a context which ensured there was continued public confidence in the criminal justice system for people with mental health and learning disabilities, but also to recognise that the services generally in communities for people with mental health and learning disabilities are very inadequate. And what we should really be doing is building up those services within communities to try and stop people getting into the criminal justice system in the first place, rather than only dealing with them when they have offended. So I reported to government and made 82 recommendations. And these are just some of what I believe are the crucial ones. First of all, crucial early identification and assessment, particularly for children. And one of my first, but if we move to what is the normal procedure, first point of contact which is at the police station. What we need is more effective support for the police at that first point of contact. And that's where I recommend what I've called my criminal justice mental health teams, so that they are the support group for the police at that first point of contact, so that early assessment and identification can take place and information gathered on the individual so that the right decision, proportionate to the offence that may have been committed, can be decided at that point. Crucial to that is for those people who are Section 135 and 136 of the Mental Health Act, that they are transferred to places of safety and appropriate places of safety at the earliest opportunity. Too many, as you know, end up in police cells awaiting some presence of medical input to make those assessments. My criminal justice mental health teams is, I believe, the transfer of the commissioning of healthcare in the police station to the NHS. Invested, or the government invested, quite effectively in better prison healthcare. That is now being overwhelmed by by the number of mental health cases in prison, and secondary care is dealing with all of them. And what we need is more investment in primary care in prison, so we have the range of services within the prison setting to have the maximum impact on the needs of the individual when they're in prison. Tools between all the organisations so that there's a common understanding of what the issues are for that individual, and we need much better protocols on information sharing so that the barriers that are placed between organisations are more effectively broken down. Commissioning will be crucial in this, not only commissioning on healthcare, not only commissioning through the criminal justice system, but crucially joint commissioning, so that we look at the service as a whole, we look at budgets as a whole, we look at breaking down the silos of working as a whole, so we can use the money we already have in the system more effectively to have a better outcome for the individual. What we need is champions of this agenda at a local level, at a regional level, to say we can make change, we can do better, we can reflect the complex needs of individuals. And if we all work together on that agenda, I think we've already seen examples of new practices, new criminal justice teams being set up, and real change in the way that people are being treated on the criminal justice system. I think with your leadership, we can achieve that effectively. Thank you very much.